Well, greetings again. This is Dr. Bill Wyatt, and we were talking about cyst today on a couple of videos we made, and I wanted to tell you about two real unusual cysts that I observed and treated. Well, I treated one of them, one of them I would have treated, but it didn't work out that way. And these were in Africa. We were there for about, my wife and I and kids and everything, we stayed 3 solid years in Nigeria. And in these cysts, I found one in Ibadan, Nigeria, and another one in Enugu, Nigeria, but I worked there for about 1.5 years in each place. The cyst that we saw, I was going to draw some of the stuff about the cyst, and it'll show you what we found. Okay, now I'm just going to draw off what I saw, but the one in Enugu, Nigeria that I found was on a policeman. He came in and he had his whole, well, we're just trying to draw like this, in his jaw up here, and this would be a pretty picture of a jaw coming back on the other side, the teeth and everything in here. And the cyst had formed from a follicle around the cuspid tooth. And this cyst was about the size of a hen egg in this man's jaw. And he came in with this problem, and I had learned about cysts and everything and knew how to deal with them if I could get cooperation. It's going to take a while to do this. So on this policeman, that this was his jaw here, we opened a spot on the cyst, and I put a iodoform gauze into that. I packed it in there, and he came back in the office for at least a couple of months there, where we would take this iodoform gauze out probably every week or so and put some more in there, and we kept it open, and this cyst just shrunk up and kept shrinking up until it came to, there was nothing but the tooth that was formed, the thing was in the open. So it just did away with this, and this jaw shrunk in size in this area, and it came in. And so this is the slow way to deal with cysts, but in my way of thinking, it's the best way to do, because teeth that are pushed out of place, cysts have no problem enlarging the bone structure, just pushing it out and making a large spot. So I'll tell you about the one that I saw in Ibadan, Nigeria. They sent this in, and I'm going to erase this one right here. And they sent the guy in from the hospital in Abomashaw, and I was in Ibadan and had this dental clinic. And this young man came in to the office, and I'm going to just kind of draw something here to represent the jaw. And this fellow's jaw was about as big around as my wrist here. I mean, it looked like a huge jaw here, just sticking out here in front. And it was just really large. Come back in here. And you'll have to use your mind here to fix this. I did not have any cameras to take pictures of this. Now, of course, the other side of the mouth is kind of like that. This whole mouth, the whole jaw of this man was a cyst that went around like that. And he had a hole in the bottom, right under the chin here, about the size of my fingertip here. It was right under there. He came in and they did this at the hospital in the moment show and sent him down there and hoping that I would be able to work on him. Well, this young man, he looked like he was about 24, 5, something like that, but he did not speak any dialects that any of the young people in the office spoke, and I couldn't really communicate with him. But anyway, I had a little flashlight, and now you think if I'm under this jaw, like the jaw was coming in like this, and I got under the underside here, and I had a flashlight that had a little head on it. I shined it up in there, and this looked like a cave, and the roots of the teeth were hanging down in here like that, all the way back, and this thing was just all a solid cyst. The whole jaw from this side over here, and the teeth were just hanging down in here. And it's just wide open like that. And so I said, well, what we'll do is pack some gauze in here or just put some in and let it drain, and this would have shrunk up again and shrunk away. But the young man didn't understand what we were talking about, and he got up and never came back again. I would love to have followed this case to see if it would shrink down to where your teeth would be back in the jaw where the cyst was gone. It had formed from a follicle on one of the teeth in this area. And that was the most unusual cyst. And I've told this story several times in lectures, and I've never seen this again. And of course, in the States, you wouldn't see this. Somebody would do something with it before. But this guy's jaw was just huge all the way around. And he had a cyst that involved the whole lower jaw. And all the teeth were hanging down in there like you were looking around in a cave, and these stalactites hang down. It's either stalactites or stalagmites, whatever. They in caves. I've been in caves and seen this, and that's kind of what it reminded me of. But the guy was, he didn't really trust what we were planning to do. If I could have talked to the man and gotten through to him, or if I could have had one of the young men in the office and known his dialects. Nigeria, there's some 250 different dialects spoken, and this guy, he didn't want anybody to mess with it. So he left, and I don't know what happened to it. The opening they had in the jaw probably closed up, and if it did, the cyst just kept going. So I hope you can learn something from that cysts just move, and as they come in there, the bone will just move out of the way, and the cyst will just get huge. And this one that was as big as a hen egg on the jaw of the man, I kept it open for 2, maybe 3 months or something like that, and the thing just finally shrunk up to the normal size of the jaw, and the cuspid where the cyst had started ended up in a place where you could use that. Thank you for watching, and I hope you sign up with our deal and subscribe to our channel. And if you are having problems and want to learn orthodontics, go to the American Orthodontic Society. You can check out, we've got their address and everything online here, and they have their office. Their headquarters is in Grapevine, Texas, which is just about 5 minutes from the airport between the Dallas-Fort Worth airfield there. Thank you for watching, and I'm going to sign off now.